Tell us about the Duchenne Muscular Dystrophy Registry and its purpose.
So the UK DMD Registry was set up back in 2006 when clinical trials for Duchenne were a real possibility and starting to happen. The registry was originally designed to help companies recruit people into their clinical trials, but over the last 15 years things have changed slightly, and now we focus on helping pharma companies do feasibility studies to work out which trials could take place in the UK.
What are some important considerations for maintaining a registry and keeping it updated?
The considerations for any registry depend a little bit on the data you're collecting, but also where you're collecting it from and how you're collecting it. So we collect data from patients. We used to collect data from clinicians, but that's challenging because often clinicians don't have a lot of time to devote to filling in registries. If you're collecting data from patients, you need to think about how you're going to maintain engagement. You don't just want patients to fill it in once, you want them to come back and give you more data over time. That's before you think about bigger considerations like data security, giving people access to data, and how you'll achieve those things, which are often the more complex questions.
What are the main ways that you let patients know about the registry?
Like many other rare diseases, the clinical and academic area for Duchenne is quite small in the UK, and so everybody knows about the registry and the other systems. So often when families are diagnosed, they're told about the registry very quickly afterwards. We often get a phone call within a few weeks of diagnosis from families wanting to sign up to the registry, because I think like many rare conditions, families really want to take part in clinical trials if they can.
How has the DMD registry helped to improve patient care and/or impacted research?
So over the years, the DMD registry in the UK has responded to many queries. So we've helped bring lots of clinical trials to the UK to help our families gain access to those trials as early as possible. We've also helped researchers do studies directly, so we can send out surveys to small groups of patients that fit the criteria for that research project. So we've also helped clinicians to audit clinical practice over the years and supplying data, for instance, about how many people are taking steroids in the UK.
What are your top tips for patient organisations looking to set up a registry?
It's very easy when you're setting up a registry or any kind of system like this to think you'll collect everything, you'll have all the data available in one place. Often it's better to go the other way around and start with the question. So think, what's your system for, what's it going to do? And collect the data that helps you to do that and answer that question. You can always add to that over time, but it's important to always be kind of driven by that one purpose. You can make the case that if you think in a year or two's time it would be useful to have this data, then actually you could start collecting it now to establish a kind of history for that data set. But again, always have that question in mind. It might just be a slightly broader question.